Hi everyone, we are Group 6 and the health system that we are presenting today is the multimodal approach in the United States. Here's the agenda for our presentation today. As Dr. Gordon explains in her overview video, this healthcare model is considered multimodal because of the different models it has for different populations. A few examples of these tools are the military and veteran systems, the systems for vulnerable people, and the Indian health system. The military and veteran system provides free healthcare to active duty military personnel. Medicare and Medicaid are available for vulnerable populations, and the Indian health system is the only healthcare system that is available for a specific ethnic group. The many players that are involved in this health system, like insurance companies, employers, the government, and other health service institutions, make it difficult to provide uniform healthcare, and their interests can end up counteracting each other. A brief history of the U.S. healthcare system will provide some context and show how far the country has come. Pre-World War II, the U.S. did not have a substantial healthcare system. There was no national insurance, medical education was not rooted in science, and there were only a handful of hospitals around the country. In the 1900s, the American Medical Association was created and becomes a national force. During this time is also when doctors are no longer expected to provide free healthcare services. In the 1940s, companies started to offer health benefits to incentivize workers to work for their companies. Also, in this decade, national health insurance was introduced, but was ultimately blocked by the Truman administration. As the country continued to progress through the 50s and 60s, more companies were offering health insurance, but healthcare costs continued to rise. Medicare and Medicaid were introduced in the 60s, which were significant laws in providing assistance for healthcare costs. As the United States tried to combat costs, HMOs were introduced in the 70s to provide federal assistance as healthcare costs still continued to rise. Finally, from the 80s through the 2000s, various things happened to combat these rising costs. Healthcare and health insurance begin to privatize in the 80s, managed care expands through the 90s, and the Affordable Care Act was enacted in 2010. The ACA made affordable health insurance available to more people. The law provides consumers with subsidies that lower costs for households with incomes between 100% and 400% of the federal poverty level, or the FPL. Expanded the Medicaid program to cover all adults with income below 138% of the FPL, and supported innovative medical care delivery methods designed to lower the cost of healthcare generally. Here's a flow of funds in the U.S. healthcare system that shows the complications of payments in this health system. Please pause the video for further examination of the diagram.
The United States has a total population of 331.9 million, with an area of 379 million square miles. It's approximately 65% of the world's surface, with around 4.4% of the world's population. If you look at the graphic here, you'll see that the lit up areas are where the majority of the population is concentrated, and you will see a correlation of population concentration and access to and quality of healthcare. The birth rate in the U.S. is 11 per 1,000, with a death rate of 1,043.8 deaths per 100,000, an infant mortality rate of 5.44 deaths per 1,000 live births, and a life expectancy of 76.4 years. This graphic illustrates the life expectancy at a different time, but still the correlation remains of a huge amount of healthcare spending with a less than average life expectancy. This graphic is meant to show you the percent of U.S. population of certain groups that will later become apparent in the slide presentation in terms of healthcare importance. So here you see those who are less than 65, less than 18, female, those who are white, disabled, and uninsured. Now, when we look at those who have access to quality health insurance, you'll note later in the slide presentation why these are particularly important, but of course those less than 65 are not eligible for Medicare, and less than 18 would not be eligible for child care benefits. Female, we talk about reproductive rights and childbearing, and so on. Here we're looking at the number of deaths by leading cause of death, and you'll see that the top 3 in the United States are heart disease, cancer, and COVID-19. One of the interesting things to note will be how this changes in the future, but cancer and heart disease have been very solid in their place as 1 and 2. Moving on to our pest analysis, politically, our system lacks integration and coordination without a central governing agency. We see differences at the federal and state levels, for example, Medicaid. Heavily active interest groups quickly change priorities. In 2010, we saw the Affordable Care Act bring expanded insurance coverage and access. 2022 brought us Roe v. Wade overturned by the Supreme Court, leading to limited reproductive rights access to contraception limited as well. 2024, we see the next presidential election on the horizon. Economically, the country is rich in natural resources with subsequent enterprising use. Couple this with a free market, open competition, profit motive, private ownership, leading to the largest economy in the world, with healthcare being the largest industry within that economy. We sit at a 3.5% unemployment rate. Looking at workforce, 25% of physicians graduated from foreign medical schools, and 52% of nurses are considering leaving their current position. 14% of Americans with medical debt plan to declare bankruptcy later in the year because of it. Sociologically, we see unequal access due to high cost, disparities across racial, ethnic, socioeconomic, and geographic groups, disparities in the insured versus the uninsured, and all of these disparities lead to unequal outcomes. Technologically, we have state-of-the-art technology with an infrastructure that is highly developed in the private sector, but lacks central planning and control, leading to high cost. Specialists are currently outpacing primary care, which leads to a focus on acute care and further increase in costs. To summarize, primary issues in this system are lack of coverage. When you look at other developed countries, we see healthcare perceived as a right and not a privilege, with 9.8% of our population under the age of 65 being uninsured. Disparities among racial, ethnic, socioeconomic groups, insured versus uninsured, and geographical, as evidenced by closure of rural hospitals. And lack of a true system. There are various features, components, and services within a fragmented system, with numerous private insurance plans and tax-supported public programs. There's periodic incremental changes in response to concerns about cost, access, and quality, but no overarching plan for change. And one sentiment that is important to note is a paradoxical one, in that Americans believe that the system needs major reform, but on an individual level, we're mostly satisfied with our own care, which leads to a stymie and inertia for change.
Hi, so regarding governance, the role of the U.S. federal government in our healthcare system is relatively limited. There's 2 primary roles. The first major role is that the U.S. federal government, right, via Congress, is responsible for passing healthcare legislation, like the Affordable Care Act in 2010. The second major role is that they are responsible for creating federal agencies that perform oversight, enforcement, administration, and policy-making functions in the healthcare space. One of the third functions, not necessarily a primary function, it does to some degree, is some funding of some healthcare for some citizens. The federal government generally does not fund healthcare for its citizens. However, it does fund and provide health care for veterans. It also does so for citizens age 65 and over, and contributes some funding and regulation to the states for health care for uninsured minors and low-income citizens. Hi. All right. So as far as governing entity goes, right, the primary organizations that are these federally created agencies relating to healthcare in the United States is the Centers for Medicare and Medicaid that oversees and administers CHIP, right, for uninsured children, Medicaid for income qualifying recipients, and also oversees the national healthcare marketplace. There's also the Department of Justice, right? Their job is to enforce federal laws. They have a healthcare fraud division that, as you would guess, prosecutes fraudulent actors within our healthcare system, right? There's also the Department of Health and Human Services. They oversee many, many different departments. Their job broadly is to help see to the health and safety of citizens by the administration of these programs. All right, so as far as the orientation style in the United States healthcare system, there's both living simultaneously the social justice orientation, whereby, right, we as a country have said we're concerned with equity and fairness of providing healthcare for certain classes of citizens, VA, Medicare, CHIP, and Medicaid, right? Those who have served the country, those who are elderly, those who are children, and those who are low-income citizens, right? It's equitable to give them some form of health care, and so the U.S. federal government is involved in that. As far as the prevailing approach in the United States is this market justice orientation. Makes sense. We're sort of a free market economy. You can see that in the majority of citizens are covered by private or employment-based health insurance or simply pay out of pocket because they don't have health insurance.
The primary purpose of health insurance is to help people get timely access to health care and protect them from catastrophic costs in the event of serious injury or illness. People in the U.S. fall into one of three categories when it comes to health care coverage. They either have public health insurance, private health insurance, or they are uninsured. To be considered insured, you have to have comprehensive health insurance, which is defined as covering the basic health care need. In 2021, 91.5% of the population had some form of insurance, and 8.3% were uninsured. There is no nationally defined benefits package, so covered services can vary greatly depending on factors like the insurance type, the state you live in, your age, income, employment status, and family size. Medicare is federal fee-for-service health insurance program for anyone age 65 or older and some people under 65 with certain disabilities or conditions. It is only offered to individuals, and in 2021, 93.4% of adults 65 and older were enrolled in Medicare. The number of Medicare enrollees will continue to increase as the population continues to age. Medicaid has two parts. Part A is hospital insurance and is free if you worked for at least 10 years and paid into Social Security and Medicare. Part B is the medical insurance, and it requires you to pay a monthly premium based on your income. Together, they help to pay for medical care services, including hospitalizations, physician's visits, prescription drugs, and preventative care services. The services that Medicare does not cover must be paid for out of pocket. Medicare participants can elect additional coverage if they are not satisfied with the original Medicare. Each of these options also has a monthly premium. I want to point out that Medicare Advantage, or Part C, is Medicare-approved insurance plans that are administered by private health insurance companies and not by Medicare. The main form of public insurance is Medicaid and the Children's Health Insurance Program, or CHIP. Medicaid is a joint federal and state program that provides health and long-term care coverage to almost 90 million people with limited incomes and resources. States operate their Medicaid programs within federal standards in exchange for matching funds from the federal government. It is a major source of funding for hospitals, community health centers, physicians, and nursing homes. Medicaid eligibility requirements vary across states, and in many states, millions of poor uninsured adults fall into a coverage gap because they earn too much to qualify for Medicaid, but not enough to qualify for the marketplace premium tax credits. The map below shows the variability of people covered by Medicaid and CHIP in 2022. Medicaid has federally mandated benefits that all states must provide to recipients. There are optional benefits that some states will provide, but again, these will vary by state. Over 1/3 of children under the age of 19 had public health insurance coverage through Medicaid or CHIP in 2021, while 15% of working age adults and 7% of people over 65 were covered through Medicaid. Looking at race and ethnicity, 59% of non-elderly Medicaid recipients were people of color. Private health insurance covers 66% of the population, with the employer-based insurance covering the majority of people in all age groups. Plan benefits and costs vary by provider, and you will lose coverage if you separate from your job. The last two types of insurance are for the U.S. military and veterans. Both TRICARE and CHAMP VA cover a wide range of medical care services for free within their respective systems. Last but not least are the uninsured. In 2021, 8.3% of U.S. residents did not have health insurance and had to pay for healthcare services out of pocket. Most uninsured people are in low-income families and have at least one worker in the family. Adults are also more likely to be uninsured than children. There are sizable disparities that exist among races and ethnicities. People of color made up 45% of the non-elderly U.S. population, but account for 61% of the total non-elderly uninsured population. Asians have the lowest rate of uninsured people. Costs still pose a major barrier to coverage for the uninsured, and in the states that have expanded Medicaid and ACA marketplace coverage, they have almost half the rate of uninsured people than the states that did not.
Now we'll review performance of United States healthcare. If we combine 4 factors of cost, equity, access, and quality into one measure, United States is the lowest performing country among OECD. Cost first. With a 4,000% increase from 1970s, United States has the largest expenditure on healthcare in total and per capita. Despite its high expenditure, United States has the lowest performance and affordability of healthcare among OECD countries. The lion's share of healthcare expenditure goes to hospitals, followed by physician services. Private insurances, outpacing Medicare and Medicaid expansion, pay for most of the costs. High cost of healthcare and its administration, along with low affordability and performance, are causing challenges. Medical debts are the leading cause of bankruptcy in the United States. The country has shifted recently to providing value-based care, capitation models, and promoting health-saving accounts. Let's switch to quality. With a life expectancy of 76.4 years, the leading causes of death are chronic diseases and trauma among Americans. Life expectancy and mortality have been improving in the past 4 decades, but at a lower rate compared to OECD countries. Compared to other OECD countries, Americans had a shorter life expectancy, suffer from more chronic diseases, and avoidable deaths. Regarding maternal and infant health, United States has the highest rate of infant and maternal mortality. Looking at a few specific scenarios, Americans suffer from an outrageously high rate of death due to assaults. However, thanks to the state-of-the-art medical facilities, they enjoy a lower mortality from heart attack and stroke. Less than half of the Americans believe the quality of healthcare is excellent or good. However, and paradoxically, 72% believe that the quality of healthcare they receive is excellent or good. Regarding access to healthcare, still a significant number of adults fail to receive the care they need due to its cost. High number of emergency room visits reflect its function as a safety net. American consumes large number of prescription medications with analgesics on top of the list. Compared to OECD, United States has the lowest rate of hospital beds and one of the lowest rate of practicing physicians. US is the only high-income country that does not guarantee healthcare. Combining quality and access, US has the lowest performance among OECD countries. However, Americans have better access to medical specialists and subspecialists and enjoy advanced medical technologies. Safety net providers, including emergency rooms, provide significant amount of care to uninsured and underinsured individuals. We'll review the impact of multiple determinants and their complex interplay on equity in healthcare, where United States again suffers from the lowest performance amongst OECD countries. Affordability is probably the most important determinant, more so among women, Blacks, Hispanics, and low-income adults. Although introduction of Affordable Care Act decrease inequity, the significant impact of race and ethnicity is still clear. Racial inequities are profound within all states in the country. African Americans suffer from more avoidable deaths than whites. Hispanics and Asians are more likely to be non-citizens or naturalized citizens. Lack of citizenship limits access to healthcare.
The multimodal healthcare approach has revolutionized the medical industry. and we have witnessed several notable innovations in this field that have led to a significant impact on patient outcomes. One of the most significant innovations that has arisen from the multimodal healthcare approach is the use of telemedicine. With telemedicine, healthcare providers can remotely monitor patients, provide consultations, and offer medical care. This technology has been particularly useful in rural and remote areas that would have otherwise had limited access to medical facilities. The use of video conferencing and other communication technologies has also improved patient engagement and education, enabling patients to manage their conditions much better. Another important innovation that has come from the multimodal approach is the introduction of electronic health records, EHRs. EHRs have replaced the traditional paper-based medical records, and they have several advantages over their paper-based counterparts. For instance, EHRs can be accessed from anywhere, making it easier for doctors to collaborate on patient care across different locations. Additionally, EHRs provide a more comprehensive view of the patient's medical histories, allowing healthcare providers to make better informed decisions and provide more personalized care. The use of artificial intelligence and machine learning algorithms has also had a significant impact on healthcare. Machine learning algorithms have been used to analyze large data sets, such as medical records and images, to identify patterns and make predictions about patient outcomes. AI-powered devices have also been developed to aid in the diagnosis and treatment of various diseases. For instance, the use of AI-powered devices for monitoring blood glucose levels has helped diabetic patients manage their conditions more effectively. Another notable innovation that has come from the multimodal healthcare approach is the use of wearable technology. Wearables such as smartwatches and fitness trackers have been developed to monitor various health metrics such as heart rate, blood pressure, and sleep patterns. These devices provide patients with a better understanding of their health, and they can also alert healthcare providers if there are any concerning changes in their health status. A couple examples of companies that are transforming the multimodal approach would be Teladoc, which is a telehealth company that is bringing access to healthcare to many different areas that might have not been able to be served otherwise all across the country, and ClickPoint or Point-Click Care, which provides long-term health centers with the ability to provide high-quality care, improve engagement of the employees, and measure compliance to that care that's provided. It's transforming really how people are cared for in these centers. And in conclusion, the multimodal healthcare approach has led to several innovations that have transformed the medical industry. Telemedicine, EHRs, AI-powered devices, and wearables are just a few examples of the technological advancements that have emerged from this approach. These developments have not only improved patient outcomes, but also enabled healthcare providers to deliver more personalized and efficient care. As technology continues to advance, we can expect even more innovations to arise from the multimodal healthcare approach.
The mixed model healthcare system offers areas of improvement to address issues related to cost, quality, access, and equity. In relation to cost, the U.S. healthcare system is one of the most expensive in the world, and improvements could be made by implementing payment reform initiatives, using technology to help streamline things, and promote preventative care options in healthcare with the chronic disease management focus. Despite the high cost of healthcare, the U.S. healthcare system does not always provide the highest quality of care. Improvements could be made by implementing evidence-based practices which have been shown to improve health outcomes, using electronic health records to reduce medical errors, and improving care coordination among healthcare providers to lead to more comprehensive and effective care. Access to healthcare also remains a significant issue for many Americans and is an area of improvement by initiatives that aim to expand coverage, improving healthcare provider capacity in underserved areas, and continuing to invest in telehealth and mobile health technologies. The U.S. healthcare system often fails to provide equitable care, with disparities in health outcomes affecting communities of color, low-income individuals, and other marginalized groups. This can be improved upon by increasing diversity in the healthcare workforce, investing in community-based healthcare initiatives, and addressing social determinants of health. Several major innovations and reforms have either already been introduced or are currently under consideration in the U.S. to address the challenges facing the healthcare system. For cost, value-based care models, drug pricing reform initiatives, and an increased focus on telehealth are all options. Regarding quality, patient-centered medical homes, the use of electronic health records, and quality reporting initiatives all promote transparency and accountability and allow patients to make better informed decisions about their healthcare. In terms of access, Medicaid expansion, the use of community health workers, and an increased availability of health insurance exchanges all help increase access options for citizens. And regarding equity, health equity initiatives aim to address the root causes of health disparities. Cultural competency training and workforce diversity initiatives all aim to increase the diversity of the healthcare workforce and reduce bias in the delivery of a patient's healthcare needs. One specific opportunity for improvement in the U.S. healthcare system is to implement a universal healthcare system that ensures access to healthcare for all Americans. Currently, the U.S. healthcare system is a mixed model, as we've seen, with a combination of private and public insurance programs. However, as has been noted, the current system has several limitations, including high costs, limited access, and inequitable access to healthcare. By implementing a universal healthcare system, all Americans would have access to affordable and high-quality healthcare services, regardless of their income, employment status, or pre-existing conditions. This would help address the issue of limited access to healthcare services, particularly for individuals who are uninsured or underinsured. In addition, a universal healthcare system could also lead to cost savings in the long run. By pooling healthcare resources and negotiating prices with healthcare providers and pharmaceutical companies, a universal healthcare system could lower the overall cost of healthcare in the U.S. This could help to address the issue of high healthcare costs that only continue to rise, which is a major concern for a majority of Americans. Furthermore, a universal healthcare system could help to improve healthcare quality by promoting preventative care and reducing the reliance on expensive and often unnecessary medical procedures. This would lead to better health outcomes for individuals and a healthier population overall. Overall, by implementing a universal healthcare system, it would be a significant opportunity for improvement in the U.S. healthcare system. While it would require significant policy changes and political capital, the benefits of a universal healthcare system are numerous and could lead to a more equitable, accessible, high quality, and cost-effective healthcare system for all Americans. That concludes our presentation. We look forward to answering any questions you may have.
Looking at the race and ethnicity of Medicaid recipients, we know that 59% of non-elderly Medicaid recipients were people of color. Despite policy efforts to improve the affordability of coverage, cost still poses a major barrier to coverage for the uninsured, and many of the uninsured cite the high cost of insurance as the main reason they do not have coverage. In 2021, 69.6% of uninsured non-elderly adults said that they were uninsured because the cost of coverage was not affordable for them. Another reason people are uninsured